if you don't get anything as a porter, you know. Yeah. But it's nice to get a job with one of those hospitals because, you know, in order to get pretty teeth as well, you know, they give good dental insurance and all, and health insurance. And that's a big thing. That's a big thing in America here, health insurance. Um, of course, Marvin Lee, definitely, definitely, definitely. Go ahead and do so. But yeah, when you work with those hospitals, those facilities, especially if you're an immigrant, I would tell anybody, go ahead and, you know, get one of those jobs with hospital that has benefits, you know, and if you're looking to upgrade yourself, there is always a lot of places, they do have programs in place that you can advance your career or start your career if you're here and you're not, you know, you're not doing anything really. So that is one way you can actually advance yourself. They have programs for RN, they have programs for CNA, and you know, if you decide that you want to go as far as getting your master's, that is something else that they will assist you with. But you know, once you start out with them, there is gonna be some form of bonding. So yeah. But the benefits, you definitely want it. I would encourage anybody to get the benefits because health insurance here in America is something else. It is something else. I was talking with someone this morning regarding you know, the cost associated with getting things like, you know, like if apart from your medical, when you do your medical, you know, that's fine. If you do your annual exam, that's fine. But when it comes on to everything else, you have to have money in your pocket. You have to have a lot of money in your pocket because even though I'm a nurse and you'd think that I know about health insurance and all them stuff here, I'm still confused. I'm still confused about the, you know, why we have health insurance because at the end of the day, when I go to the hospital, if I check into the emergency room, and even though the hospital says that I have insurance, I get insurance with them, you know, I realize that the hospital I have to still go ahead and pay, you know, my copay, which nothing is fine with that. But then you have this thing called deductible, and if you don't meet a deductible per year, or if you don't meet your deductible at the time when you are, you know, in the hospital, it's like, you know, if you don't meet a deductible at the time when you check into the hospital, it's like you're wondering why, in the sense, you have the insurance because, you know, the insurance is not going to really cover anything. You know, it's not going to cover anything. And then the other thing you have to understand is that when hospitals do give you health insurance, you know, they give you health insurance, and when you check into the hospital, yes, it will cover a little bit, but then you have to remember that the doctors who are seeing you, they're not even covered with the health insurance. They're not even in network. So basically, you're getting a health insurance package from a hospital, and sometimes you're wondering if it really makes any sense, you know, because the doctor who's seeing you is out of network. Then you're supposed to go and get your labs done. It's another, you know, money. Then you're supposed to go and get a CT scan done. The radiology department is going to send you a bill. Radiologist is going to send you a bill. And then you look, it's like you're spending thousands of dollars for healthcare just for one little minor emergency that you show up to the emergency room. And God bless the amount that the health insurance is going to pay for. But at the end of the day, the bigger picture is the health insurance is going to be beneficial if, the Lord forbid, and a couple weeks later, you know, you met in an accident and you're admitted for a long time, you know, you will be able to benefit from the health insurance. But for persons who are not really, say, using their health insurance or not sick, and you're just going to do your regular annual exam, you say you go and you do your pap smear every year, you go and do your dental, your vision. Yes, you might not, you know, you'll pay zero to nothing or less than $100 probably per visit, or $0 because it's your annual, you know. But if you're the kind that is always sick and everything, then you're gonna have to spend a lot of money in order for you to reach your deductibles. So yeah. Marvin Lee says, thanks, share the knowledge and experience you give each time on here is awesome, and I appreciate that. Thank you so much, Marvin, for saying that. Thank you so much. But most importantly, I definitely wanted to go ahead and share it with your friends, all right? Share the channel with your friends so you can get more persons hearing and getting more information as well. Cassie's Kitchen says, Cassie's Kitchen Creation says, good evening. Hi, thank you so much, Cassie, for tuning in. How are you doing? Yeah, so when it comes down to that, you know, it's nice to have the health insurance and all, but but it's a lot of money. Sometimes you have to be spending out of your pocket. Like the other day, I went and did a test, and I had my health insurance, and then my health insurance with the cost to do the test with the health insurance was gonna be, I think it was like say $600 and something dollars, and then out of pocket without the health insurance is like $500 and something dollars. So it's like $100 difference, in terms of using the insurance or not. And to me, that's just a little bit excessive. It's just a little bit excessive. You can imagine patients who have like, renal failure on dialysis, and they're supposed to be getting medications to help with, their blood pressure, or they're supposed to be getting dialysis, and they can't even afford $15, $15 for their medication because insurance is not covering $15. It's kind of confusing. It's very confusing, the health insurance here, but I still encourage persons, make sure you have good health insurance, because you don't know what will happen, later on. All right, Cassie's Kitchen says you have to get pre-approval for just about everything. Then you have to pay $200 and up before the procedure is done. Exactly. Because if you don't meet your deductible, then it's like you cannot get anything done. And that's just sad, because, as I say, you have a lot of persons out there who need to get their procedures done, and they have insurance and they still can't get anything. A lot of patients of mine, they have insurance, and these persons are living on, like, say, $500 disability, and their blood pressure medication is probably like $150. Insurance is not covering it. And so you have for $500, you're going to choose between whether or not you're going to pay your rent, or you're gonna choose whether or not you're gonna be paying your rent. You're gonna be paying your rent or purchasing medication, that way. And so you find out that persons are not gonna even buy the medication because it's so expensive. All right. But the healthcare here is something that we definitely have to think about, especially when we're moving from, from Jamaica or from anywhere else. Definitely read up on the health insurance, because there's so many things you definitely have to even, understand with the health insurance. You definitely have to understand a lot of things when it comes on to health insurance. But still go ahead and get your health insurance, even if you don't know anything about it. Just make sure you get something that is good. And another thing that I would encourage persons who are transitioning, short-term disability, long-term disability, make sure you get those. And your dental and vision, yeah, you're fine with those. Because those are not that bad in terms of price, those are not bad as in terms of price. But you definitely want to get those when you get here. Monique Hayes says, hi, good night. How are you doing, Monique? Thank you so much for tuning in. That's why I took a big pay cut as a nurse and work a state job, because of the health insurance. Yeah, the health insurance, when you look at it, you have to kind of decide whether or not you want health insurance, good health insurance, or, you just want to continue working for the amount of money that and especially if you have a lot of underlying problems, that as well should be one of the factors you think about when, when you are thinking about, your job. Think about whether or not it's going to be beneficial for you to be getting this amount of money, or whether or not the insurance company, not the insurance company, but the company is going to be giving you a good insurance package, So look at that, because at the end of the day, it doesn't make sense you're getting a lot of money and then the insurance package that they're offering is not anything, substantial, or it's going to make any sense for your health. So if you have certain underlying problems, just make sure you take one that is going to help with that. And another thing is, I always encourage persons to take out, along with your medical, take out all the other things that they offer. So they have like critical, they have a critical care insurance or critical plan that includes like cancer and some accidental injuries. Go ahead and do that, because you don't know what can happen. But then again, you see those plans that they have, it is like so confusing, because sometimes it only may mention that if you cut off your big finger, that's the only time you get covered, you know, that kind of way. So just make sure you read on them and get them. I think it's called critical illness plan. Yeah, the critical illness plan. Make sure you get that, because that is very, very important as well. And there is also one, it's an indemnity insurance. Indemnity insurance, hospital indemnity insurance. And as I said, the prices on these are very, you know, small. So you probably end up spending like, say, $8, $10, $15. And it's a lot of money that you'll get. So in the event that, so for example, you're admitted at the hospital, you know, you definitely have something to help with paying the out-of-pocket expense. So say, for example, the insurance is going to cover 80% or 70%, then the other 30% you're supposed to be covering with the fact that you have the hospital indemnity plan. That will go ahead and cover the remainder if you have enough money in that, depending on the plan that you take. So I would encourage anybody to do that. Royal Look Vlogs. Hi, hello. You're tuning in from India. Thank you so much. Thank you so much for tuning in. And says from India, but I need only $500. Okay. Royal Look. Let me see. And then Cassie's Creation says you need to make sure you have a cancer plan. That exactly so. That is exactly so. You definitely need to have a cancer plan. Monique says, I agree. Thank you. Next time I call you on your podcast. Thank you so much, Monique. Thank you. Definitely. The number is 469 209 9257, and I will definitely go ahead and put it on the live in the comment section of the live, as well as the regular comment section on the channel. All right, so that way we can have a discussion. What year are you in, Monique? So that was 469. Yeah, but the insurance, that is something that, you know, when I moved here, if I never really know anything else, I definitely make sure I have really good, you know, I have a really good car insurance. Anything that they offer, I just take it. You understand? Because especially if you don't have any families here and no friends, you don't want to be a case where you just left hanging, you know. So to get everything in terms of insurance. And I also do get the high end of whatever insurance package they have, just in case, you know. Even when I never have any baby and never planned to have any baby at the time, I still went ahead and get something. Well, you know, you don't know what can happen, you know. So I went ahead and did a family plan, even though it was, you know, you can make adjustments to your insurance whenever you have a child or if you're married or anything like that. But I was just kind of looking ahead because I don't want anything to come and then mess up, you know, my plans and everything. So just make sure you have really good plans for your insurances and whatever, even if you don't think you need it. If the price look like something that you can spare, just go ahead and spare the extra $5, $10, whatever it is, to get the insurance. Oh, Monique says she's in Florida now. Okay, nice, Monique. I definitely want to hear your stories. So I'm gonna go live tomorrow. I think I have someone who is, tomorrow is what, Wednesday or Tuesday? Oh, tomorrow's Tuesday. But if you want, you can call me tomorrow if you're free. I'll be online tomorrow around this time as well, you know. But I'm gonna have someone on Wednesday, and then from there, I'm gonna try to be consistent with my live at least every Wednesday, but then I'll do, like, you know, impromptu pop-ins here just to kind of chit chat with a few of my subscribers. All right. Kia says hi. People don't understand. We have free healthcare in Trinidad, and people don't understand how expensive healthcare is. It makes me upset because they come every few months because of non-compliance to medication. Please, so let me put it on there. Yeah, that's the thing. A lot of persons don't understand, you know, the health insurance, and for persons who are getting medications free and all, they don't even understand that for some persons in other places, they can't get it. They cannot get it. They don't really understand the, let me put this number here. All right. So text me on this number, Monique. Text me on this number, and then I will send another number to you. So that's the number. Just text me on it, and I'll speak with you regarding the call the next day. All right. But yeah, a lot of persons, they don't really understand how healthcare is expensive. Like when I was in another state, at one point, at that time, I just moved to the state. And you know, sometimes when we're in Jamaica, we will be doing, so we do a CBC, CMP, you know, you do your PTT, and you do all of those testing. You do a urine test. And sometimes we take it for granted because we're like, oh, yeah, we're just doing the CBC, CMP, and we don't really think about, you know, saying that, okay, then there's a cost associated with it. I remember when I was in a state working as a nurse, and, you know, for everything, you know, we did, if you do a blue top, if you do a purple top, if you do a yellow top, all of those are billed individually. And then when we do a urine test was like roughly $150. $150 for somebody to just pee in a container and do the test. When you talk about an IV that you put in your arm, that was just going for probably like say $150, $180 per stick. So you have some facilities that definitely you have to chart in, like, you know, how many times you poke the patient. There's a reason for that, because it is being billed. So if you poke the patient 3 times and it's a missed IV, the patient is getting billed 3 times. Then when it comes on to ultrasound guided IVs, you know, sometimes you have to say whether or not it's a straight stick or whether or not it's the ultrasound guided IVs. When you do put an ultrasound guided IVs was running anywhere between like $1,100 and $1,500. You know, so it wasn't a case where you are just putting in IVs and everything and that was it, or using their ultrasound guided machine. That's why I keep on telling patients, like, let us try to get your IV first as a regular stick before we go ahead and do an ultrasound guided IV, because it is expensive. It's cheaper to get 3 pokes and be billed for those 3 pokes, which is roughly 3 times 150 is roughly $450, than to get poke 2 or 3 times with an ultrasound guided IV. You're being billed almost $4,000 or $5,000 there for just one little poke. You understand? So a lot of persons always come and be like, oh, I'm a hard stick. Yes, dear, we know you're a hard stick and we can see. But at the same time, let us just try in the meantime, because hospitals do bill based on those things. So just be careful. Did you want to call now, Monique? Or that was just you sending me a message to let me know your number? Yeah, so that's about it. But health insurance is very expensive, and you just have to understand it so that way, you know, you can get the full extent of it or the full use of it. And at the same time, you have to understand it so, you know, you're not confused a little bit more than you are when it comes on to this health insurance here in America. And then when the people are giving the medication from the health insurance, please go ahead and take the medication. That's the other thing. So patients want all of these medications, and you know, them sit down and look at the medication. They sit and look at the medication, and they don't understand how expensive insulin is. They don't understand how expensive like these blood pressure medications are, you know, and rather than taking it to help with their, you know, their illness, they literally just not take it as you say, not take it, and then they come in and expect you're gonna work miracle to save them when they're in their DKA. So you know, Monique says, just sending you a message, we will talk in the week. I'm getting off shortly. Okay, no problem. Thank you so much. I will definitely save your number. I'll text you, Monique, as well. Thank you for tuning in. I'm gonna actually wrap up shortly as well, because I thought I was gonna be on for a short period. But yeah, the healthcare, the good thing about Jamaica is that we have free healthcare. So that's a plus for our people down there. We have free healthcare. And so we have the National Health Fund that does, you know, provide some medications for patients, which is good. And even some of our, you know, chemotherapy drugs, so we are able to get that access for them. So even though we might not have every single antibiotic or IV antibiotic, and a lot of times, you know, if you're admitted inpatient, sometimes patient's relative would have to go ahead and purchase those IV medications, you know, having the National Health Fund is a plus for them. It's a plus for them. And I think a lot of the patients down there do, you know, they're compliant with their medications for the most part, I must say. They're pretty much compliant. We don't really have that much persons coming in DKA or, you know, stroke or having, let's just say, a lot of heart attack. We don't really have that much, thankfully. So I think they're pretty compliant with their medications, you know. So, yeah. Alrighty, well, thank you so much, guys, for tuning in. Do we have any other questions, any comments before we go? And please remember to go ahead and double tap on the screen if you haven't done so as yet. And if you haven't subscribed as yet as well, I would love for you to subscribe. All right. And then, as I say, please remember to tune in. I'll be on the live on Wednesday. I will try to pop in during the week as well, depending on how my schedule is. And we can have a sit down as well. You know, you can always ask questions, and I hopefully have topics that we can discuss just to hear your insight on certain things. All right, but for now, it is 8:22 p.m. I know for some persons we are like 8:30 or probably 7:30. So I'm just gonna say it was nice, you know, sitting down and talking with you guys, and thank you so much for tuning in. And as usual, you know, please remember to subscribe and remember to leave a comment, okay? All right, so enjoy your evening now and enjoy the remainder of the week if I don't see you or you don't see me, but you know, go out with, you know, God's love. All right, enjoy your evening. Bye.